Welcome to BCN's new series, What's Happening Now, a collection of informational and hopefully entertaining programs where we substantively speak to interesting and important people. Guess who's returned today? Jim Madson, Beaufort County Health Director. He's come back to visit with us and talk to us specifically about what's going on in Beaufort County in terms of health and especially COVID.
Hey, Stan.
Hey, how are you doing, Jim?
Good, thank you very much.
Jim comes to our county meetings once a month and gives an expose. You can find those on Beaufort County Now. We segment those so you can see Jim today. And we're going to hit a lot of questions that I ask. And then you can see him give his monthly report on Beaufort County Now, where the commissioners meet and Jim visits with us. Jim, we've had some tough weeks here with COVID, haven't we?
Yes, I'd say the last month has been a pretty high trend in our county, going up.
I've noticed since the last time we met, roughly 5 to 6 weeks ago, we've more than doubled the confirmed number of cases in Beaufort County, and the deaths have gone from, I believe, 9 to 17.
Right, we're at 17 deaths right now, and I am investigating 3 others to see if they are COVID related. I wait until I get the death certificate before I make that determination, but we have. And a lot of that is attributed to the long-term care facilities that we have in the county. They, over the last month, have seen increases in numbers, and of course that population is more vulnerable, so they're more subjective to more, death due to the COVID.
Just like we see the wildfires in California running wild, going hither and thither, we had that problem in our aged home facilities.
We do, and this is true in North Carolina, it's true in the United States, and of course now Beaufort County, we're seeing that same impact once it gets into a nursing home or a residential facility, that the virus spreads quickly and then of course with major consequences because of it.
In Beaufort County, we haven't done anything egregiously stupid like they did in New York by taking COVID victims who are suffering from COVID, and it is very real for them right then, and putting them in a nursing home to rehabilitate themselves.
No, the health department actually works with the facilities to try to decrease the number of exposures that occur in a long-term care facility. One of their strategies may be if once they get somebody positive, they move them to a facility that, because they're owned by many facilities are owned by the same companies, so they'll oftentimes designate one of their facilities as a COVID building, and they'll move all their positive cases to that building. And of course, the staffing of that building are people that have already had or recovering from COVID themselves, so they're less likely to be spreading it around in that facility. And that's one strategy that's used. Others may not have multiple facilities, so they'll designate a floor or ward as their COVID ward, and they'll try to do the same thing. As soon as somebody's positive or if they're symptomatic, they'll remove their roommate and then try to get them into a more of a isolated area.
Is this a situation that's actively regulated by the Beaufort County Health Department?
No, it's the procedures and policies of the residential home.
Okay.
But we try to work with them within their protocols, their infection control policies and stuff like that to try to help them to minimize it. And of course, we'll go in and do the testing if they need us to.
Okay.
So and we do that weekly. Once you have an outbreak occurring, we'll go in and either assure that they're doing it weekly, or we'll go in and do it weekly.
Somewhat of a benevolent oversight by the county?
It's not. No, I wouldn't even call it. Oversight sounds very governmental,
It does, doesn't it?
So I guess in that sense that we do try to make sure that they're following the policies and procedures, because the residents there are county residents, so we do try to protect them in that sense. But a lot of the relationship has occurred over the years, because we do the same thing for flu. Whenever flu gets into a long-term care facility, we go in and we kind of talk to them and try to help prevent the spread of the flu. But again, COVID seems to be more contagious than the flu in these situations.
With this outbreak that we have right now, and these I would call them extended care, but I don't think there's any extended care in Beaufort County, is there?
Well, I mean, some of them are.
Some of them
Some
are.
of them are in those facilities for a long time.
Yeah, extended care. Are you guys watching them very closely and making sure that they, now that it's gotten worse, are you taking a little more active look?
Yeah, right. We don't, like I said, we don't really regulate them. The state regulates them.
They do?
So the health department, we only go in there when they have an outbreak that's occurring.
Would you report to the state if that you see something
Oh,
that
they'll
others
see it.
may? They'll see it?
Yeah, we could report it as well, but they typically see it. The state runs, because we do have to report it through the outbreak investigation portal that we have at the health department. So we do a lot of data entry for all the cases that we have, and we link them to a long-term care facility. So the state is aware that it's going on. So if you go to the state website, you can see all the outbreaks that are occurring at all the long-term care facilities in North Carolina. And it'll show you the number of positives, and it'll show you the staff positives and the resident positives. So that information is out there.
So the state is cognizant of what's going on, and they would take a more active role in investigating at times like these?
Correct.
Okay, very good.
Now,
so we're safe in Beaufort County with the state looking into it and with you guys providing some oversight, for lack of a better
guidance.
word.
I would say that we try to be more of a guiding
Yes.
entity agency for them. We can't force them. I mean, there's not really much that we can do because the state regulates their licensing. And like I said, it's been a partnership. It's always been a partnership that we've developed because of flu and for other diseases that may break out at long-term care facilities. So that's a lot of the same thing we've done in the past.
While there's an outbreak now in these aged home facilities, extended care facilities, it's not like we've seen in other places. We've had, 3 or 4 elderly die in the last few weeks?
Well, 5 or 6.
5 or 6 elderly
that are linked
die.
to those long-term care facilities.
We're not seeing dozens or hundreds dying, and there are a lot of people in these facilities. So it's not like the chances of them surviving has dropped precipitously. It's there's a little blip right now, and it's been taken care of.
Well,
and managed.
I don't think the outbreak can be declared over yet. I think that it's very. It's probably going to be going on for at least 3 more weeks before we can say that it's over. But for the last 3 weeks, we see these spikes because we go in and test them every week. So every time we test them, we're seeing cases.
So basically, you guys have done what you can do. The state is involved now.
Right.
Certain protocols, more extensive protocols, are probably put in place.
Right.
And we'll just have to see what happens. A lot of what's happening with COVID is we don't know much about this disease. It's going to take months and months to really get a handle on it. I mean, we just found out about COVID back in December of 2019, and nobody, Republicans or Democrat, President or Speaker of the House, thought that it was going to be as serious as it was. And once they did find out, once the president found out, he started moving very quickly. Now we're still having to move quickly and somewhat dance with the problem. And let's talk about that vaccine. The operations coming out of the federal government is moving quickly, isn't it?
It is. So the state, it was just last week, the CDC put out their program plan for the vaccination. So when that came out last week, that put the states on a 30-day notice to have a state plan in place. And so I think it's, we're talking about mid part of October now, the state will have to have its plan in place. And I am fortunate enough to be on the state planning committee representing the local level operations of the vaccine plan. So I've been working on that. There's the planning, the assumptions are that the vaccine will be here in the fall, and then the mass vaccinations will occur in March timeframe. So it's just a matter of planning out how we're going to do it. And of course, you have to prioritize because it's going to trickle out at first, and then mass numbers will come later. So they are in the trial phase for some of the vaccines. So they're trying to get the bigger trials going right now. And then they'll, once that gets approved, then you'll be able to see the mass manufacturing that's occurring. And I think you're going to want to do the healthcare workers and the first responders who are at high risk because of who they're in contact with. So think about those long-term care facilities. The staff that works at those long-term care facilities would be a high priority. Those residents of the long-term care facility will be a high priority. So that would probably be our first group, will be those more vulnerable because of where they're at and where they work. And then the next group will probably be your most vulnerable population in the general population. So your elderly and those who have health conditions that would make it bad for them if they were to catch COVID. And then the next phase would slowly get down to the point where you'd make it open for everybody.
So the first responders, then the elderly, or those with pre-existing conditions. I get the first responders. That's very important. These folks are keeping us in check, so to speak, if not well. The elderly, a lot of folks, I think I would qualify for that. And then your people with pre-existing conditions could be of any age. Who do you think will take priority, the elderly or the pre-existing conditions?
Well, I think it depends on what the pre-existing condition is and how far down the path they are. Because, if you're a newly diagnosed diabetic, you're probably not at risk as much as you would be if you're, a failing diabetic that's later on in the course of the disease. So I think there's going to be some of that individual calling that's going to have to be made on something like that. So I think that the vaccination is going to be released to the providers. So, the clinic that you go to for your care, they may end up getting 100 doses. And then they would make that determination as your physician. And they may realize they only have 100 to give out. So they're going to give it out to those who they think is going to be at higher risk than somebody that may have that disease, diabetes, let's say, but is not out of control or they're doing okay.
Do you feel at some point that this vaccine will be distributed by the health department?
Around the March timeframe, and I use March in planning purposes only because, I don't know if we're going to get that much vaccine by March because, some people say it may be June or July or August. So, but for planning purposes, around that March timeframe, I hope that we will receive enough doses for us to open up what we call pods or point of distributions. And we'll open up like one in Washington, one in Belhaven, one in Chocowinity, and one in Aurora. And we'll man those stations, and then people will be able to come through. We'll do it either for 1 week or 2 weeks, depending on how much of the population we hit. And everybody will be able to drive up there and get the vaccine that way. That's what we're hoping for around March timeframe.
I have one last question before we take a short break.
Okay.
Will you be responsible, Beaufort County Health Department, for triaging the folks, or will it just be for anybody that comes?
At that point, it'll be open for everybody that's coming through because we'll already have gone through the other phases prior to that.
Okay. Mm-hmm. Thank you, and we'll be right back. Let's talk about what's happening in Beaufort County, what you know about the human element. Folks, how are they reacting to COVID? Are they taking it more seriously now than they did in the very beginning, or are they taking it less seriously? And by that, I'd like for you to branch into the 3 W's, but tell me about that.
Well, I think and I'm not a scholar about human behavior, but I would say that generally the conversations that I've heard breaks everybody down into three groups, where one is defiant and they're not going to follow any of the guidelines that are given out there. Then you have another side that's very alert about the situation, and so they're practicing a lot harder. I think that both groups have gotten bigger over time. So you have kind of your middle road people who are practicing a lot of the things because it's expected of them from society, and so they're following that. You've got a large group of there, but I think that you have a lot of them migrating to one way or the other, where they're either being very cautious or they're being very relaxed.
And then you have the folks in the middle,
which are just following the guidelines as best they can, which is the majority of the people, I think, are trying to stay in the middle and following that. But you do have your other groups, and of course they're the more vocal about the whole situation. But I think that as the virus has become more ingrained in our way of living and stuff like that, I think most everybody is doing a self-risk assessment, determining whether they feel like they're really at risk. And of course, just like any other thing in life, you got some risk takers and you have other people that are very cautious. So I think you're seeing the same kind of patterns develop. But as a whole, I think I'm seeing more people wearing the mask in public, and I think people are more aware of the 6 or 7 feet apart kind of concept.
We're 7 feet apart, by the way.
Right.
And that's why we're not wearing masks, because we're 7 feet apart. We're not virtue signaling here. We're just doing what's appropriate.
Right. And I think the recommendation of a mask is meant a lot for your public.
Yes.
So when you're going out in public, like you and I, we did a self-assessment. Neither one of us is really sick, but we are still maintaining that 6 feet apart. So the mask is, wearing the mask at this point would be a lower risk, but our risk is so low from our own risk assessment.
You might not be afraid or frightened, but there is a courtesy factor there, isn't there?
And I think that's right. I think that's what I mean by that middle group. They're looking at that courtesy factor. They're saying to themselves, it does lower my risk. It's kind of like just following the speed limit.
Mm-hmm.
Some people speed around and they're at increased risk for accidents, and then you got your crowd that follows the speed limit and tries to stay within it.
I went out to eat. I think it was in early August. I've only been out twice since COVID, both times out of town, and both at seafood restaurants. But I went to the seafood restaurant, and it was too crowded for me to go in. And I think they've had to limit their how many people they could put in. Was it 50% now?
50%.
Still seemed like it was more than 50%. It's a very good seafood restaurant. But there was a gentleman that walked up to the door, and he was carrying his mask. And he looked in there and he said, "Oh, I don't see people wearing masks in there. I guess that means I don't have to wear one."
All right.
That's a different mentality, isn't it? Would that guy fit in the middle? Because he only wears a mask because somebody else tells him to?
Well, I think he's leaning towards a risk taker, but
I think you're right. Yeah. I think we in society should do what we feel comfortable. Nobody knows 100% if masks are completely effective or not. Right now, they're leaning towards masks being more effective than not. With what we know and what we don't know, maybe it's better that we don't take any chances.
I mean, I think that's a good cautious way of looking at it. I do think it lowers your risk, and that's again, we all make risk assessments every day in what we're doing and what we don't do, and so the mask has been shown to lower the risk, which is not the same as it stops the risk. The mask does not stop every possible contamination that can occur. It's just something that helps lower that risk. So by one person wearing the risk, it lowers it a little bit more. When both people that are interacting with each other wear it, it lowers it even more. But again, it doesn't bring it to zero. It just lowers it.
No, I do not have an N95. So when I go out in public, I wear a double mask.
Right.
I like to tell people, well, the top one's for you and the bottom one's for me. And I don't know if that's going to help, but the chances of me getting them sick have greatly decreased. I might still get sick if they're not wearing a mask, but at least I'm being courteous, right?
Right. I think you're being courteous, and I think you are, again, lowering that risk.
Yes.
It's not to zero. And that's the key thing, as you weigh whether you wear because some people argue it doesn't stop it. Well, it doesn't stop it, but it lowers that risk of you getting it. So that's the determination that you need to make. So that's one of the 3 W's that we talked about, was wearing the mask. And then the other one was the 6 feet apart, or the W meaning weight. Weight, you're 6 feet apart, which is, again, key to the whole distribution of a droplet whenever you cough or you sing or you talk or that kind of stuff. So that 6 feet helps maintain that lowered risk of it getting to the next person over being 6 feet apart. And
I was thinking about picking up my guitar and singing to you. Maybe I shouldn't, right?
Well, I don't know which is worse, the droplets or your voice.
Probably both.
Yeah. And then I forgot what the third one was.
Washing your hands.
Yeah, washing your hands. And that's probably one of the most important things that you can do, is because, despite wearing the mask, despite being 6 feet apart, the droplets are potentially on everything that you touch. And, and so by washing your hands, you're eliminating those the virus load that's on your hands.
So it's the person to person is all about the droplets. If somebody touches something and then you touch it, if they don't have any droplets on their hand, you're not going to get anything.
Well, yeah, if you're sure they don't have the droplets on their hands. Yes.
Okay, so and you remember when the whole mask wearing did not start because we were told by the federal government it might be better if we don't wear masks, save the mask for the first responders, okay? Mm-hmm. And they said, plus, you'll spend a lot of time adjusting, readjusting, and it could be more dangerous. Even Dr. Fauci talked about that. So this whole idea of not wearing masks, it started with the federal government, did it not?
Yeah, and I think that was, again, the point being that it lowers risk, but it doesn't make it zero. So when they're talking about wearing the mask, they're approaching it from it doesn't make it zero.
Yeah.
So in other words, there are other things that you could have done early on that they thought was better. So,
yes. But
now they realize that it does lower their risk. So we're going to move over to that side. And that happened pretty quickly once we started realizing that even if you cough and it lowers the probability of transmission 10%, that's still lower, so. And
what I'd like to state for the public, before we make COVID a political issue, and it really shouldn't be a political issue, it's a health issue.
I do, yeah.
Please, public, understand there's been a lot of different kinds of information coming out. And guess what? We know a lot more now than we did before. And in the future, there's going to be different information coming out because why? We're learning more. So we have to be ready to change. And you're going to be at the tip of that spear probably understanding what those changes are.
Right. Yeah, I mean, we've changed. We changed who we thought we should test early on. We adjusted going from testing people to not testing them in order to just assume that you have it, to going back to massive testing, which is the phase that we're in now. But, I guess you get to a point in a community where testing is it's not going to really stop things from happening. There's just too much spreading going on. So you keep wondering if, testing is still going to be available. That contact tracing part of it, to where you're trying to get in front of it, gets more and more complicated to try to stay up. So, even though we're doing a lot of contact tracing right now, I could foresee us having to back up on some of that contact tracing and just start doing more of an educational campaign, about staying home if you're sick. And hopefully people know that already. But,
one would hope.
Yeah.
Jeez. I mean, I feel your pain having to deal with what you've got, with what little time you have, and provide the service we need in this county. People.
Let me just say, if I can, that it's the staff at the health department in Beaufort County. They're excellent. They're excellent people. They are working. They're staying up on top of this. We are still doing this contact tracing, and I don't think we could be any more proud of the nurses and the health educators and the clerical staff and, social worker and WIC, they're all chipping in to call people that are negative. There's a lot going on. Every day I could see that hard work going on at the health department. And as the director, I can't even contribute any of that to me. It's all because of all the work they've been doing. And as a commissioner, you can be proud of what's going on at the
Well, I am proud. As I see those numbers going up astronomically every day, I think about all the work you guys have to do. Yeah. I mean, we just have a few cases. Back when we met last time, I went back and did a little research. There was around 450, 460 cases. Right? Yeah. Now we're up close to 1,000.
We should hit 1,000 today or tomorrow.
In 5 weeks. And you've had a lot of work to do. You've had more deaths. We have a lot of active cases being reduced, though. That's good.
Right. I think right now, we're at a kind of a plateau, about 230 to 250 active cases any one day. So as we're getting more coming on, more are going off.
Yeah, it's disproportionate. We got more coming on, but we got a little bit more coming off than coming on, because once a new case comes on, that becomes an active case. Right. And I'm noticing you have 15 new cases that day, and then you've got 4 active cases. So you've got a net change of 11 going off, right?
Yeah, potentially, yes.
Yeah, something like that.
And right. So usually about 15 days after somebody's tested positive, they get put in as a recovered person. It's harder to monitor them even closer. So what we do is do an approximate number of active cases instead of actually tracking down whether somebody still has positive or negative in their nose. So usually you think about the course of the virus running about 10 days long. So we give them about 4 more days, and then we put them as recovered. As an individual, they may not be recovered, but most everybody would be. And that's why it's an approximation. But the interesting thing is that at 250 people, that only represents about half of 1% in our community has it at any one time. So it lets you know that even though it's out there and you should still be cautious about it, it's not like 1 in 5 people that you meet have COVID. We're talking about 5 in 1,000 people that you may meet has COVID.
Well, we're going to
that we monitor, that we see.
We're going to take a break, but I'm going to ask you one question. Mm-hmm. The folks that get COVID and they get well, hallelujah, hopefully everybody does. Are they immune? And if they are immune, for how long will that immunity last? Well,
I think that's one of those scientific testing and evaluations that's going to occur more.
This is some of that future information we're going to learn later.
Right. Because generally speaking, if you have a virus and you fight it off, you're going to have at least some immunity for a while. That's true with almost every virus that we know of. There are some exceptions that aren't lifetime necessarily, but I would tend to think that most people are going to be immune if they've had a really good reaction to the COVID. So if they've gotten the fever and they've gotten the cough or symptomatic, I think that we're going to find that most of them have immunity. Now, whether it's 5 years immunity or 20 years, I don't know. However, if you have COVID and it's just in your nasal cavity and you have a mild reaction, like a hay fever type reaction or something like that, it's possible that you don't create enough of an immune response to trigger that immunity, sustained immunity. So that's possible. I think you're going to find that.
So the logic is, if you feel like you're about to die, you're probably going to be better off later on.
Well, I guess you can summarize it that way. But yeah.
We're going to take a short break, and then we're going to wrap this up. We need to practice the 3 W's. We need to wash our hands. We need to practice social distancing. And we need to wear a mask whenever possible if we're not practicing social distancing. And I guess we got to think about the mask. It's good to have it in reserve because there's a lot of times somebody's going to walk up to you when you least expect it. And it's good to have that mask at the ready or on.
Well, yeah. I mean, I think it's better to wear it, especially when you're in public. You know?
Yes.
Again, when you're meeting with individuals, and you know, you're made that assessment as it being a low risk. You know, that's one thing. But when you're in public, you don't know who the person is that walks up to you. You know, you don't know if somebody ends up coughing close to you, or so if they have a mask on, you have a mask on. You know, it's a lower risk.
My wife was watching the commissioner meeting, and she saw somebody come up and start talking to me during the meeting. Well, it was a short break, and I didn't have my mask on because it kind of caught me unawares. I mean, I'm doing my commissioner thing, and then this he's got to talk to me before he leaves. So, you know, what do you do in a situation like that? Maybe I should have had the mask on. I don't know. I have it at the ready. And if somebody kind of comes close to me, I try to put it on as soon as I can.
Right. Those are scary situations. But, you know, again, there's odds of things. And so you make that risk determination. And if you really want to avoid that potential, you know, you got to have your mask on, and then you got to be willing to say, hey, back up, you know, I'm being COVID thoughtful or something.
Exactly. Let's be courteous.
Right.
Well, it's kind of hard for politicians to tell somebody, you need to be courteous. Leave me alone.
Right.
We also have the mass testing going on right now. How long will that continue?
Well, I mean, it'll continue for a while. We're, you know, at the health department, we're working with different groups in the community to try to take testing to some of the sites where some of our citizens have a more difficult time accessing medical care, or they traditionally don't access it, you know, for whatever reasons. And so we want to make sure that the testing is available to them. Because again, we want to make sure that they're notified if they're positive so that they can maintain some safe, you know, distancing and stay home. So we got a lot of things that we're trying to work with different communities.
And you are testing on your campus right now?
Every Thursday from 9 to 11:30, we do have open testing at the health department.
And do you need an appointment?
Anybody can just drive up during that time period and get tested. Throughout the rest of the week, you can call and make an appointment, and we will test.
I'm located very closely to the health department, and I ride by it often. And I noticed there was only about 3 or 4 cars there waiting. So if you want to get a test, if you think you've got a problem, there's no need to take a test unless you think you may be sick, because this is just a snapshot.
It is.
It's a snapshot of your health. It's not antibody testing. It's just to see if you've got it right then and there. And you're going to have to wait how many days to find out?
Generally about 48 hours, about 2 hours, up to 3.
So that might be a good thing for you. So go if you need it. Don't go if you don't. If you're just curious, don't go.
Yeah. A great deal of our testing is for contacts. So once we get somebody that's positive, we call and they say, well, I was, around these 12 people, then we contact those 12 people and we try to bring them in to get tested so that they can, first off, they're going to be quarantined for 14 days. Regardless of whether the test comes back positive or negative, they're quarantined because they're a close contact.
Again, it's the snapshot. You don't know when it's going to kick in for them.
Right, because most people will get sick about the 6th day, between the 3rd and the 6th day of their infection. So you put them on 14 days because some people won't get sick until the 11th or 12th or 13th day.
Does anybody go beyond the 14th day?
At one in a bunch. I don't know what the exact number is.
That's good information, though. 3 to 6 days.
Generally. Most people, yeah.
I've been going with the 14-day rule. If I'm around some folks, if something happens, somebody walks up to me and they don't have a mask on, I don't have my mask on, they're talking to me. So 14 days is optimum. 3 to 6 days is more the mean of when you might get sick.
Correct. Where the 14 days is the other end of the curve.
That's good to know. And we've had the outbreak in Beaufort County, but right now it's centered mostly in extended living facilities.
Yeah, I would say we're having a slight increasing trend in Beaufort County. I think that trend looks a lot worse because of the outbreaks that are occurring in the long-term care facilities.
Long-term,
right?
Extended living. I guess it is extended living, taking care of long-term care.
But because long-term care includes nursing, residential facilities, group homes, detention centers are considered long-term care facilities. So all those are kind of lumped into that definition.
Have you ever seen a mass outbreak, a plague, a pandemic in your days of being with the health department? Not this health department, but all health departments.
Well,
Anything
in general,
like this?
H1N1 was pretty prominent of a pandemic. Of course, it didn't have quite the number of deaths that COVID has, so it was a little bit more under the radar as far as the public was concerned. But it was spreading, and it did have its higher number of deaths.
Thank God it went away.
It did, yeah. And we went through a vaccination program with that too. A mass vaccination occurred for H1N1.
Good. And vaccinations, would you advise people to take the vaccination?
Yes, I would. I know there's a lot of concern about the safety of the vaccine because some people feel like, well, they pushed it through. But the FDA is monitored that. And I was actually listening to a phone call from the FDA who highlighted the fact that the vaccinations that they're doing nowadays, the technology is there to make it safer because they're using a lot of the same chemicals that they've always used with flu and with other vaccines. So those aren't necessarily going to be new chemicals. The only thing that's really going to be new to the chemical or to the compound, the vaccine, is going to be the antigen, what makes you react to it, which stops the COVID virus from getting in you because you have the immunity to it. So if that's the only thing that's going to be different, then there's really not a different chemical in there that's going to have some kind of a safety issue attached to it. So really the question is whether it's going to work or not work. But I don't think it's going to cause any side effects other than your other general side effects that all vaccines can do. So I think safety-wise, I'm not too worried about this. The reason they're able to do it so much quicker is because the United States, the Congress, and the President all put a lot of money into the manufacturers. Manufacturers put some money into themselves, so they're already mass producing. So most of the time, you produce a little bit, you test, produce a little bit, you test. It's kind of linear in nature. But this one here, they're manufacturing and they're testing at the same time. So that kind of gives them a big supply earlier on. That's what they're planning on doing anyway. So I know right now they're already manufacturing. Even if this vaccine gets thrown to the side, at least it's ready if it does become a good option.
There's a good chance we're going to have it by the end of the year. Everybody keeps their fingers crossed. Practice social distancing. Wear masks whenever you can. And let's be safe out there. Jim, thanks for being with us today.
It's my pleasure, Stan.
Will you come back again?
Sure, yeah.
This is very educational. And folks, you need to listen to this man. You may do some things he suggests that keep you alive. Think about it. Goodbye, and we'll see you again next week.